Hi, hello. Welcome to my YouTube channel, Pushu Daily Life Vlogs. This is Dr. Nagaraju Bandaru, Associate Professor, HOD, Department of Pharmacology, School of Pharmaceutical Sciences, Sandip University. In this channel, I am going to discuss about the human anatomy and physiology, biochemistry and clinical pathology, pathophysiology, and pharmacology. And this channel is very helpful to, especially for the healthcare professionals like for B Pharmacy students, PharmD, M Pharmacy students, MBBS, dental students, BSc nursing students, physiotherapy students. Why? Because in these healthcare professional courses, mainly it contain human anatomy and physiology, biochemistry, pathophysiology, and pharmacology. These are the major important subjects in the healthcare professionals. So that's why this channel is very helpful to this type of students. So today I am going to give the brief introduction about the how this interlink about the human anatomy and physiology, biochemistry, pathophysiology, and pharmacology. So if you see anatomy, already you know anatomy is nothing but it is mainly the study of the organ structure. So for example, if you take the organ, one of the example of the organ is a heart. So this anatomy is mainly deals with the how many chambers present in the heart and what are the tissues is made up of by the heart. So everything it will be we have to study it in the anatomy. Coming to the physiology. So physiology is nothing but it mainly deals the how our organs will be working. There is nothing but it mainly deals with the physiological functions of the organs. For example, heart. What is the major function of the heart? It mainly pumping the blood. So in this physiology, how what is the mechanism behind the pumping of the blood? So everything we have to discuss in the physiology. Next, coming to the biochemistry. So biochemistry is mainly deals with the biomolecular pathways. Okay, what is the happen in our human body? Best example is enzymes reaction. So what are the different types of enzymes? What is the structure of the enzymes? What is the how they are playing important role in the metabolic functions? So like that we have to discuss in the biochemistry. Next, coming to the clinical pathology. So this clinical pathology is mainly deals with the diagnosis procedures by performing some blood tests or urine tests, whatever it may be. So by using this clinical pathology, we have to diagnose the disease. Next, coming to the pathophysiology. So this pathophysiology is mainly deals with the pathogenesis of the disease. For example, is hypertension. So what are the major causes for the hypertension or what is the major pathological pathways mainly involved in the hypertension? So coming to the pharmacology. So this pharmacology is mainly deals with the study of drug actions on the living organisms. So it mainly deals with the how the drug is acting, what are the side effects, what is the pharmacological effects, and what is the ADRs, what is the dose, what is the clinical contraindications, etc. We have to discuss in the pharmacology. So these five areas very important for the healthcare professionals. Why? Because we have to treat, if we want to treat any patient, first of all we have to understand the anatomy, physiology, biochemical pathways, and pathological pathways, and next how the diagnosis, we have to diagnose the disease. Based on the diagnosis we have to give the treatment. So best example, I will give one example. For example, if you take the diabetes, right? So diabetes is one of the metabolic disorder, all of you know. So in this, how the anatomy is related to the this diabetes. So anatomy is mainly study the structure of the pancreas and its role in the insulin production. So we all of you know insulin is mainly produced from the pancreas. Before that, we have to know what is the structure of pancreas, how many parts is present, which type of tissue is made up of. So we have to study in the anatomy. Next, coming to the physiology. The function of insulin is, what is the major function of insulin? How the insulin is mainly regulating the blood glucose levels. It mainly related to the physiology. Next, coming to the biochemistry, how the biochemistry is mainly play an important role in this means we have to understand the molecular process involved in the insulin production and how this insulin is play an important role in the glucose metabolism, etc. Next, clinical pathology. So by using this test. For example, how we will find out the diabetes by performing the glucose measurements or HbA1c test. So by performing some tests, we have to measure the glucose levels and we have to diagnose the diabetes. Next, pathology. So abnormal insulin function in the diabetes. So how what are the abnormalities is mainly present in the insulin? What is the pathways or maybe insulin resistance? Okay, or which type of resistance it will happen? We can easily understand in the pathophysiology. So after that, pharmacology. So if you know the pathophysiology, so then we have to design the treatment. So maybe we have to take the insulin, or maybe we have to take the oral hypoglycemic drugs based on the type 1 or type 2. So why I am telling means, if you want to treat particular disease, so first of all, we have to understand the anatomy and physiology, biochemistry, pathology, and then we have to go for the pharmacology. So that's why these five key areas are mainly interlinked with healthcare professionals. So that's why in this channel, we are going to discuss in detail about the anatomy and physiology topics, biochemistry topics, and clinical pathology topics, pathophysiology topics, and pharmacology topics in detail. So by the next class onwards, we are starting with anatomy and physiology. So please all of you subscribe my channel and support to me. Thank you.